So whenever I was first introduced to EMDR, obviously the thing that stands out is the eye movements. My friend and colleague, Dr. Michael Curran, who introduced me to it and invited me to the training up in Derry, said, "Do you want to go to this eye movement thing?" So eye movements was there right at the start. It's probably the bit that seems the strangest to people, and often the only thing with eye movements that people can think of is hypnosis. But it's not, it's a very different brain state to hypnosis, and there's been some interesting research on that. But the important thing is that people were then looking at EMDR and saying, well, is it just cognitive behavioural psychotherapy with eye movements thrown in? And it's very important, and I make this emphasis when I'm doing my trainings, that EMDR, the bilateral stimulation or the eye movement aspect of things, is something which has a distinct and measurable effect. If we weren't to do anything, so if we were to take away the 8-phase, 3-prong protocol of the EMDR method, and I was simply to use BLS with you, either eye movements or tapping on the hands or shoulders, or having you listen to an alternating bilateral tone, the reality is all of the things that we could measure that could potentially demonstrate a relaxation effect would show a relaxation effect from that without us doing any other parts of the protocol. So we would look at things like, for example, heart rate variability, a galvanic skin response, blood pressure. All of these things would demonstrate a relaxation effect. And so whenever we have somebody who, in the work in Israel, for example, with people like Dr. Gary Quinn, teams that would go as a mental health team along with the paramedics that are looking at dealing with physical illness, go and develop Gary's immediate stabilization procedure. And that largely just involves an empathic presence and tapping on the individual in an alternating way. And that bilateral signal goes into the brain, and it goes and is received by a little structure called the anterior cingulate cortex. And as it goes in, the front part of that structure is the emotionality part, and the back side of that structure is the sort of cognitive or thinking part. And when the signal goes in, just from simple tapping, what you do is the emotionality decreases, and then has a knock-on effect where the thinking, distancing, and noticing increases. So being in a place of panic, fear, what we sometimes call frozen terror, that emotionality decreases and the person is able to begin to think a bit more, and these individuals then are able to be safely spoken with and taken out of a dangerous context, for example, after a missile attack.